Hey everyone, and welcome to Complete Conversations. This is the series brought to you by CompleteCare Health Network. Now, before we jump into today's topic, for anyone who might be new here, this entire series is powered by Google AI.
Which is pretty cool, honestly.
It is. Today we are focusing on exactly what parents need to know about their children's dental health.
It's about so much more than just a smile. It is about their overall development.
And health.
Exactly. It's February.
Which means it is officially National Children's Dental Health Month.
Yes. Celebrated by the American Dental Association. The ADA isn't just out here saying, hey, remember to brush. They want families to know that healthy teeth are vital for a child's whole body.
And I think that is where a lot of parents get tripped up. We tend to, treat the mouth like it's this garage that sits separate from the main house. But the mouth is literally the gateway to the rest of the body.
So when things go wrong in the garage, the whole house smells the smoke.
That is exactly right.
Let's set the stage with some numbers. The Centers for Disease Control and Prevention, the CDC, says that tooth decay, which we just call cavities, is the single most common chronic disease in children.
Number one. And unlike a scraped knee, tooth decay doesn't just heal on its own. It's a growing infection.
But, and this is the huge silver lining, it is completely preventable. We're here to give you the cheat codes to stop this before it even starts. We say the word cavity and everyone nods, but what is actually happening in a kid's mouth?
A cavity doesn't just magically appear.
Right?
It is caused by bacteria. Every single one of us has bacteria in our mouths.
Okay, totally normal.
But when that bacteria meets sugar or starch, it produces acid.
Oh, wow.
And that acid literally eats away at the hard outer shell of the tooth, the enamel.
And if you don't stop that,
You get a hole, a cavity.
I want to pause on that.
Yeah.
Because if your 7-year-old is up all night with a throbbing toothache.
You're not functioning the next day.
Exactly.
You cannot learn how to read or do math if you are distracted by a pain in your jaw.
Now I want to tackle the biggest myth out there.
I think I know which one you mean.
Hey, they're just baby teeth. They're going to fall out anyway. Why spend the money fixing them? Bust it for us. Why do baby teeth matter?
Baby teeth are nature's placeholders.
Like saving a seat at a concert.
That is a perfect way to put it. They hold the space open for the adult teeth growing underneath.
So what happens if you pull a baby tooth too early because it's decayed?
The teeth on either side will drift into that empty space. They tip over.
Closing the gap.
Right. Then, when the adult tooth tries to come up, the door is closed. It comes in crooked or gets stuck entirely. Exactly.
So let's give parents the how, the action plan.
Let's do it.
And let's start at the beginning. Infants, babies without teeth.
Believe it or not, dental health starts before the first tooth even pops up.
Wait, really? How?
You start by cleaning the baby's gums.
Brushing gums.
Basically, you take a soft, damp cloth or a little silicone finger brush and you wipe their gums after feedings.
What does that actually do, though? There are no teeth.
It removes the bacteria, and it gets the infant used to having their mouth cleaned.
Oh.
So when they're older and you come at them with a real toothbrush, they don't freak out.
That is a pro-parenting tip right there.
And once that first tooth appears, the clock starts on plaque.
Plaque. We hear that word on every toothpaste commercial. What is it?
Very simply, plaque is a sticky film of bacteria. It forms on everyone's teeth constantly.
So if you don't brush it off?
It traps the acid against the tooth and creates a cavity.
Okay, so we are wiping gums, then brushing when the tooth arrives. Now here is a question that confuses everyone. When is the first dentist visit?
The official rule from the American Academy of Pediatric Dentistry is, the first visit should be by age 1.
Age 1?
I know it sounds young, but there are 2 reasons. First, we can catch early signs of decay.
Like before it becomes a hole? Okay, so early detection is key. What's the second reason for an age 1 visit?
We want to establish a dental home.
A dental home. I like that.
If a kid only goes to the dentist when they are in pain, they associate the dentist with pain.
That makes sense. They're terrified.
But if they come at age 1,
You are building trust.
exactly.
Yeah.
It lowers their fear for the rest of their life.
That is brilliant. Now, I want to bring this right back to our community. This is Complete Conversations, so we have to talk about complete care.
Absolutely.
We've laid out this perfect scenario, but we know the real world has barriers. Cost, insurance, getting a ride.
Dental care is sadly the first thing families cut when money is tight.
So how does Complete Care bridge that gap here in New Jersey?
We literally bring the care to the community. We have dental sites located in Vineland, Millville, Bridgeton, Wildwood, and Glassboro, New Jersey.
That covers a massive part of the region. But what about the financial side?
We tackle that head on. We accept Medicaid and the uninsured.
That is incredible.
And our organizational policy is very clear. We make sure no patient is turned away for care.
Let me just repeat, no patient is turned away. If you are stressed about a bill, CompleteCare is saying, come in anyway.
Your child's health is the absolute priority.
We have covered so much ground today.
It is a lot of info.
But we want to make sure this sticks, so let's recap.
Let's do it.
Give us the tips every parent needs to memorize.
Brush twice a day for 2 minutes. It scrubs away that sticky plaque. Floss once a day. If the teeth touch, you must floss. The brush can't do it alone. Choose water over sugary drinks.
And
visit the dentist every 6 months for cleanings, sealants, and early detection.
totally doable. And the payoff is a healthy, happy kid.
Exactly.
I want to leave everyone with a final thought that really stood out today. It simply said, small daily habits make a big difference over time. Good habits today build healthy smiles for life.
That is the honest truth. Look, parenting is exhausting. You won't be perfect. Maybe you missed brushing one night.
We've all been there.
That is okay. But building the habit protects your child from pain, keeps them focused in school, and sets them up for lifelong health.
I completely agree. So February is National Children's Dental Health Month. If your child needs a dental home, or it's been a while, or you've been putting it off because of costs, call us.
The number is 856-451-4700.
Let me give you that one more time. Call 856-451-4700. Or just hop online and visit CompleteCareNJ.org.
You can find all our locations right there. Don't wait for the toothache to start.
Make the appointment today. Let's keep those smiles healthy and those kids thriving.
Thank you so much for joining us for this episode on Complete Conversation. We will see you on the next one.
Take care, everyone.